In our endeavour to pursue growth in various fields, we often encounter challenges that make us reflect on our role in society. World population has more than doubled, from 3 billion in 1960 to about 6.7 billion today. About 20% of people in the developing world, that's over 1 billion human beings, still subsist in absolute poverty. At Novartis, corporate citizenship forms an integral part of our business objectives and corporate vision.
Corporate citizenship is at the very core of the way we do business at Novartis. Access to medicines is a fundamental right, and Novartis supports this with donation programs, co-pay programs, differential pricing, and public-private partnerships. 50 meters away from a tarred road, and you cannot get even a simple paracetamol or an aspirin. In India, our focus is on expanding access to medicines so that people, no matter where they live or how much they earn, have the opportunity to lead healthier lives.
It is our effort to ensure that all that we do is done with the patient in mind. Our energies are focused on giving them a better quality of extended life. Working to combat leprosy, rehabilitating these patients, striving to eradicate tuberculosis, educating and supporting the underprivileged, conserving nature, providing medical assistance to people suffering from chronic myeloid leukemia and other debilitating illnesses are just some examples. The work done by the Novartis Comprehensive Leprosy Care Association is a good example of the kind of work that is being done here in India in an attempt to eliminate leprosy.
A comprehensive leprosy care project was established by the Novartis Foundation for Sustainable Development. Much before the corporate citizenship issues has been defined, the most poorest of the poor and disadvantaged people of the leprosy disabled are being helped, by the Novartis and Novartis Foundation.
Our efforts over the last 20 years have borne fruit and have succeeded in giving leprosy management a new face. We have effectively used social marketing, health education, reconstructive surgery, physiotherapy, hand and foot splints, grip aids, and the highly empowering self-care kit to tackle the problem of leprosy for several hundreds of patients in various parts of the world. At every step of the way, our endeavour has been to fight ignorance and tackle the stigma associated with the disease. Tuberculosis continues to afflict thousands of people. Every day in India, more than 20,000 people are infected with tuberculosis. More than 5,000 people develop the disease, and more than 1,000 people die as a result.
GEAT is a commendable effort from Novartis, which brings the public, the doctor or the health provider, the corporate, that is Novartis itself, and the patient. So this is a joint effort.
In a joint effort to eradicate tuberculosis, Novartis has partnered with doctors to conduct TB detection camps, sponsoring diagnosis and treatments, thereby helping a large number of people regain their lost health and resume normal life.
इसका आज पूरा ट्रीटमेंट ख़त्म हुआ है टीबी का। इसमें हमको पूरे परिवार को बहुत खुशी हो रही है, सबके साथ में बैठ रहे हैं, खाना खा रहे हैं, ज़िंदगी की जो काम है पूरी तरह से निपटा रहे हैं, कोई किसी तरह का उसमें अभी कोई डर नहीं है।
Firm in the belief that education, health, safety and environment are all interlinked with one another, Novartis partners with various NGOs working in the field of education and environment.
The volcanic eruption in Iceland disrupted air travel across the globe, seriously impacting the economy. The unfolding crisis captured the minds of the media. Age-old diseases such as tuberculosis and malaria continue to cause millions of deaths around the world and have a far-reaching impact on the global economy. And yet, they do not attract the same level of attention.
The right to childhood is a fundamental right. And yet, there are many children in India who do not know what it is to have a childhood. Through its partnerships with NGOs, Novartis hopes to give at least some children a better chance at life.
Novartis has been sponsoring this center since 6 years, and they have been actually regularly coming in and seeing the learnings of the kids, how much the kids have progressed. They come for every show of ours.
Medical advances in cancer in recent times have helped make it a better understood disease. Therapies have become more effective. Side effects have become fewer and more tolerable. And yet, diagnosis of cancer continues to impose a heavy toll on the patient and their families. Novartis set up one of the most far-reaching patient assistance programs for people suffering from chronic myeloid leukemia and GIST. Administered by the Max Foundation, the Gleevec International Patient Assistant Program, or GPAP, and Novartis Oncology Access, or NOA, have benefited a large number of patients.
जब पता लगा कि ग्लीवेक आ गई है तो मुझे सबसे ज़्यादा खुशी यही हुई कि अब ऑपरेशन नहीं कराना पड़ेगा और शायद उससे मुझे स्ट्रेंथ मिली कि जब भी हम कैप्सूल खाते थे तो ये सोच के खाते थे कि ये कैप्सूल जा रहा है, ये जाके सेल्स को मार देगा और हम ठीक हो जाएंगे.
Overwhelmed by the support they receive, GPAP beneficiaries have started Friends of Max, a voluntary group that provides counseling and support to cancer patients.
It's an unprecedented patient assistance program. There has never been anything like this. There is nothing like this. We hope there will be more like this.
Extension of life is always welcome, I mean. It's priceless. I mean, to be very honest, it's priceless because it gives you a chance to do 100 other things which you want to do.
We know deep in our hearts that much of what we do can perhaps never be quantified. And yet, the work we do gives us immense satisfaction. Much more than we can put into numbers or words. For we dare to dream of a more equitable world. A world where there will be good health, happiness, peace and prosperity for all. Till then, we will continue doing the work we do, reaching out, because we care.